Welcome to the deep dive. We're here to take the sources you provide and really pull out the core stuff, the most fascinating, most important bits, so you can get up to speed quickly, but, properly.
Exactly. We sift through it all, trying to find those key insights. And today, we're tackling the history of hospitals. It's a big one.
It really is. And our mission here isn't just about the medical timeline, is it? We're looking broader.
That's the plan. We want to explore how hospitals evolved, yes, but also their impact on society, the economics behind them, their role sociologically, even the business side of things. And the materials you sent over are great academic papers, stuff from hospital groups. A real mix.
Perfect for getting that wider picture. And for you listening, if you like getting to the heart of a topic efficiently, hopefully finding some of those aha moments without getting totally swamped, well, that's what we aim for.
We want to connect some dots, maybe show some links you hadn't thought about.
All right, let's dive in. Where do our sources say this whole idea of institutional healthcare actually starts?
Well, it's surprisingly early. We see hints. Possible hospital-like places back in Mesopotamia. We're talking maybe late second millennium BC.
Wow, okay, that is early. What drove that, do we know? Early organization, maybe? Religion?
It's hard to say for sure from just fragments, but yeah, likely early social structures, maybe religious practices playing a role, separating the sick from the home, creating dedicated spaces. Then, if you look east towards India, around the 5th century BC, Buddhism becomes a major factor.
Ah, the monastic connection.
Exactly. You get these healthcare facilities tied directly to monasteries. It's a theme that pops up again and again. And as Buddhism spread, you see mentions of nursing facilities cropping up in Sri Lanka, China, Southeast Asia.
Though we don't know exactly what they were like.
The specifics are a bit hazy, yeah, but the intent seems clear. And then you have King Asoka in the 3rd century BC, fascinating figure, apparently setting up hospitals for both humans and animals.
Animals, too. That's quite a broad view of care, isn't it?
It really is. Suggests a different kind of societal responsibility for well-being back then.
Okay, so interesting early starts in Mesopotamia and India. Now, I'd instinctively think ancient Greece, birthplace of rational medicine and all that.
You'd think so, right? And yes, 4th century BC, Hippocrates, rational medicine, huge leap. But Hippocratic doctors mostly did house calls.
Ah, okay, so not hospitals as we think of them. What about the temples, like Asclepius?
Those were definitely healing centers, but more magico-religious. Rituals, incubation, sleep. Think sanctuary for spiritual and physical rest, not really organized medical treatment in the modern sense.
Got it. Different focus. So what about the Romans? Big empire, lots of organization.
They did have something. Around 100 BC, these places called valetudinaria, basically military and slave hospitals.
So specific groups, again, not the general public.
Right. Specialized care. There's even talk of ships named Therapia and Aesculapius, maybe early hospital ships. Kind of cool.
Intriguing. But are these valetudinaria widespread? A direct ancestor?
That's debated. A lot of the identification is based on building layouts from archaeology, not loads of records or tools. So maybe not a direct line to later public hospitals. And interestingly, Jewish tradition, while big on health laws, doesn't show evidence of hospitals per se. Care was mostly at home.
Okay, so it's a bit of a scattered picture initially, different cultures, different approaches, but then the sources really seem to point towards Christianity as a major catalyst.
Absolutely. This is where things really start to come together for the modern hospital concept. Christian hospices, these xenodokia originally for pilgrims, messengers, travelers, they gradually shifted focus under church control.
From shelter to actual healthcare?
Pretty much.
Yeah.
They started evolving into places offering care for the sick. A huge milestone was the first documented hospital in Rome, 4th century AD, founded by Fabiola, a wealthy widow.
Driven by charity, setting a precedent.
Exactly.
Yeah.
Private philanthropy, Christian principles. And it wasn't just her. The church became a major player.
So this continues through the Middle Ages.
Definitely. Early Middle Ages, say 6th to 10th century, you've got the Benedictine order making infirmaries standard in their monasteries.
Just for monks or?
Often for the community, too. They were vital local aid centers, especially when there wasn't much else. Then later Middle Ages, post-10th century, things expand further.
How so?
Monastic infirmaries get bigger, more capable, but you also see the rise of actual public hospitals, funded by cities, the church, private money, a broader responsibility kicking in, and specialized places too, like leper houses, showing some early ideas about contagion.
Now, it's important to mention, while this is happening in Europe, the Islamic world is having its golden age. How did their hospitals compare?
Oh, remarkably advanced for the time. The sources suggest Muslim hospitals were often way ahead of their Christian counterparts. They weren't just care centers. They were incredible institutions of learning, real precursors to modern teaching hospitals, integrating education right alongside patient care.
That integration is key. Okay, back to Europe, medieval, Renaissance times. What's the trajectory after those early monastic and public efforts?
It keeps building. Monasteries keep providing services. Famous hospitals get founded, St. Bart's, St. Thomas's in London, Holy Cross in Winchester. Names still around today.
Wow. And the 12th century seems important.
Very. Pope Innocent III's order led to these hospitals of the Holy Ghost across Europe. And interestingly, the first one in Rome, Santa Spiritus, from 1198, its design was influenced by Islamic hospitals.
That cross-cultural influence is fascinating, and teaching hospitals were emerging too.
Yes, Montpellier's Holy Ghost Hospital was an early example, combining care and training physicians way back around 1145, so the function is clearly broadening.
Beyond just basic care, becoming knowledge hubs.
Precisely. And crucially, secular powers, kings, cities start getting more involved, providing funding and support. Hospitals become these multi-purpose places, almshouses, pilgrim hostels, and, as we said, learning centers.
And the dissolution of the monasteries in England had a big impact.
Huge. Post-1540, secular authorities had to step up more directly for the sick and poor. By the end of the 15th century, many towns were supporting institutional care. This is really the beginning, our sources say, of the voluntary hospital movement, citizens and organizations funding and running hospitals.
Okay, let's jump across the Atlantic. What were the first steps in the U.S.?
The very first, according to the records, was for soldiers. Manhattan Island, 1663.
Military again. What about for civilians?
Mostly almshouses pulled double duty, like William Penn's in Philadelphia, 1713. But you need to picture these early places differently. Doctors weren't usually hanging around.
Really? Why not?
Hospitals were often seen as, well, places for the poor to die. If you had money, you got treated at home or in a private clinic. Sort of different vibe from later on.
So more social welfare than medical centers initially, but the 19th century, that seems like a period of massive change.
Oh, huge. Economically, the U.S. is booming. Institutions are developing rapidly. Sociologically, you have that shift Weber talked about from communal ties to more associative ones, especially in cities. Families found it harder to do long-term care at home.
Creating more demand for places like hospitals.
Exactly. But, and this is important, the first half of the 19th century wasn't exactly a golden age for hospital outcomes.
Ah, right. The sources mention a dark period.
Yeah, pretty grim. Surgery was happening more, but death rates were sky high. Why? No real understanding of sanitation of germs. Surgeons reused gowns, linens. There was this awful accepted smell, the good old hospital stink.
Hard to imagine. They didn't know about infection control.
Didn't know. They even thought post-discharge was good sometimes. Tragic, really.
But then science starts catching up, thankfully.
Yes. Mid to late 19th century is the turning point. Pasteur, germ theory, Semmelweis pushing hand washing so crucial. Suddenly, there's a reason for cleanliness.
And other breakthroughs, too.
Big ones. Anesthesia, antiseptics. Surgery goes from terrifying butchery to something survivable, manageable.
Yeah.
Then x-rays in 1895, seeing inside the body. Plus, hospitals start taking on communicable diseases, isolating patients. They identify TB, malaria, develop vaccines like for anthrax, isolate cholera, tetanus. Massive leaps.
And this scientific progress fuels hospital growth.
Absolutely. By the end of the 1800s, the U.S. has like 149 hospitals, over 35,000 beds. And interestingly, less than 10% were government-run.
So a diverse mix.
Totally.
Yeah.
You had elite voluntary hospitals, often tied to universities, city-county ones for a broader population, religious or ethnic hospitals relying on fees, even for-profit surgical centers starting to appear. The beginnings of a market.
The sources had some wild anecdotes from that pre-modern era.
Oh, yeah. Robert Liston, the super-fast surgeon, the story of his amputation with a 300% mortality rate, patient, assistant, observer all died.
Yeah.
Just shows the insane risks before anesthesia and sepsis control.
Unbelievable.
Or Ambroise Paré back in the Renaissance, arguing for tying off arteries instead of burning them with hot irons, a move towards less agonizing treatment. And those no-nose syphilis clubs in London. A bizarre social outcome of disease before real treatment shows how illness impacts society.
Okay, focusing on U.S. public hospitals now. How did they develop from those early almshouses?
They grew out of them, yeah. Still focused on the poor initially. Care was basic. Sometimes you needed proof of moral worth or a sponsor. Bellevue in New York is a key example. Started as an almshouse infirmary in 1736.
And they pioneered ambulances.
First hospital ambulance service, 1869. Horse-drawn, mind you. Equipped with brandy, tourniquets, and a straitjacket. Tells you something about the times.
It certainly does. And the Civil War era spurred changes.
It did. Ironically, the sheer number of casualties forced doctors to communicate better, standardize things. You see better record keeping, early specialties like orthopedics emerging, better prosthetics. It helps shift medicine from pessimism towards optimism, especially once asepsis and bacteriology took hold around 1880. Hospitals became symbols of this new medical authority.
And by the early 20th century, public hospitals are more established.
Yeah, you see places like Somerville Hospital, Cambridge Hospital, University of Kansas Hospital, founded or growing, becoming really vital parts of their communities.
Okay, let's fast forward into the more modern era, especially in the U.S. What are the big structural changes, the ongoing challenges?
Well, a massive shift came after 1965 with Medicare and Medicaid. That created a huge new source of funding and really fueled the growth of for-profit hospitals.
Large chains, specialty hospitals.
Exactly. Hospital management companies, physician-owned surgery centers, ortho hospitals. They often do good work, but it raised questions about competition with nonprofits, community hospitals, access, cost, that whole debate.
And academic medical centers, the big teaching hospitals.
They're crucial for research, innovation, training, but sometimes slower to change delivery models. Their focus is often research, education, complex cases, so they might be reacting to market changes rather than leading them.
And the VA system, that's huge.
Enormous. Largest integrated system in the U.S., taxpayer-funded, 156 hospitals, clinics, nursing homes, many linked to med schools, so big in training too, generally has strong political backing. They're reorganizing now into these VISNs, Veterans Integrated Service Networks, trying to improve quality, access, outcomes. And they do a lot of health services research.
Inside a typical modern hospital, how does it all work? The organization.
You've got the medical staff, doctors, organized by departments, usually specialties like medicine, surgery, pediatrics, OBGYN. They oversee quality, grant privileges. In teaching hospitals, they also manage student and resident education.
And nurse.
Absolutely central. Managed by head nurses or nurse managers on each unit. They oversee staff, coordinate everything for the patient meds, therapy, dietary, social work, discharge planning, you name it. Staff work shifts, with charge nurses leading each shift. Bigger places have supervisors, a chief nursing executive.
And managing all the information must be complex.
Hugely. Management information systems are critical now. Computers handle everything from appointments and records to lab results, billing, and analyzing patient data for quality and cost control.
Alongside all this complexity, there's more focus on the patient experience, patient rights.
Definitely.
Yeah.
Rights to respectful treatment, information, understanding your diagnosis. That's codified now. But, the sheer pace and routine of a hospital can still make patients feel lost sometimes. That's where good nursing is so vital. They're the constant presence.
The way hospitals get paid changed dramatically, too, with DRGs.
Right, diagnosis-related groups came in the early 80s in the U.S. Big shift. Instead of paying based on how long you stayed, hospitals got a fixed amount based on your diagnosis.
That must have had a huge impact.
Massive. Suddenly, efficiency mattered hugely for the bottom line. It pushed hospitals to manage lengths of stay, improve discharge planning, getting that post-hospital care sorted, home care, nursing homes. But it also led to concerns about discharging patients too soon, readmissions, and sometimes patients feeling rushed, not heard. Patient satisfaction became a much bigger focus.
And measuring quality of care evolved, too.
Yes. Early on, focus was on structure credentials, facilities, but studies, like from Columbia in the 60s, showed huge variation in actual care processes and outcomes. Things like medical school ties, specialty training mattered. Now, using frameworks like Donabedian's structure, process, outcome is standard, and hospital boards are ultimately responsible for quality assurance, risk management, overseeing who gets to practice there.
Let's dig into that role of public hospitals in training doctors and in public health more broadly. That seems really key.
It's fundamental. Public hospitals have always been deeply linked with medical school training, especially GME, the residencies after med school. The Flexner Report back in 1910 pushed for rigorous training, and public hospitals were often the main places that happen. They really are the original academic medical centers in many ways.
How has that training role adapted with changes in medicine? More outpatient care, shorter stays?
It's adapted. Public hospitals built big ambulatory care networks for outpatient training. Inpatient care became more focused on the really complex acute stuff. But having the latest tech is still crucial for teaching and their mission, even with the financial strain of uncompensated care. That partnership with medical schools, driven by a shared social mission, is vital.
And they're critical for certain types of training, right? Like trauma.
Absolutely essential. Inner-city public hospitals see a high volume of severe trauma, especially penetrating trauma like gunshot wounds. It's incredibly intense, invaluable experience. Like that quote about San Francisco General, this is as real as it gets. They even train military medical teams because the experience is so relevant.
Beyond trauma, they've been on the front lines of health crises, too.
Oh, definitely. Think about the early AIDS epidemic in the 80s. Public hospitals, San Francisco General, Cook County in Chicago, Jackson Memorial in Miami, North Central Bronx, they stepped up massively.
When maybe others were hesitant.
Exactly. They provided compassionate care despite fear and stigma, did crucial early research, set up dedicated units. They were lifelines for a really vulnerable population. It was heroic work.
A testament to their public mission. And other innovations came from public hospitals, too.
Lots. Cook County started one of the first big blood banks back in 1937. Advances in aneurysm surgery, cardiac catheterization happened in public settings. And now you see things like hospice programs integrated into trauma centers, like at Stroger Hospital. Plus, many are getting involved in violence prevention, addressing community health upstream.
It sounds like these places really shape careers, too.
They do. You hear stories like former CDC Director Julie Gerberding finding her public health calling during the AIDS crisis at a public hospital, or Kirk Calhoun being inspired to become a doctor by the care he saw there. They leave a mark.
Finally, the sources mention NAPH, the National Association of Public Hospitals and Health Systems. What's their story?
They formed in 1981, basically as an advocacy voice specifically for public hospitals, especially around Medicaid funding and protecting that safety net role.
Because their needs weren't being fully addressed elsewhere.
That was the feeling, yeah. Figures like Larry Gage saw a need for a dedicated group. NAPH became crucial in fighting for things like Medicaid DSH payments, disproportionate share hospital funds.
Those help hospitals serving lots of low-income or uninsured patients.
Exactly. They're vital for keeping the doors open.
Yeah.
NAPH has been key in advocating for that funding, telling the safety net story to policymakers, and just providing support and a network for these hospital leaders. They've played a big role in helping many public hospitals survive.
So wrapping this up, it's quite a journey we've traced. From ancient healing temples and monastic infirmaries to these incredibly complex modern systems.
It really is. Hospitals have constantly morphed, shaped by religion, war, science, economics, social values. Their role has never been static. Hopefully you listening now have a clearer sense of those historical currents and why public hospitals in particular hold such a unique place in the healthcare landscape.
And that leads us to our final thought for you. Looking at this long evolution and knowing the pressures healthcare systems face today, financial, technological, societal disparity, what do you think the next big transformation for hospitals might look like? What needs, what breakthroughs will drive the changes to come? Something to ponder, considering that constant dance between medicine, society, and economics that has shaped these vital institutions for millennia.